The nation has been watching as the number of Ebola cases reported in the U.S. has increased. Healthcare providers here in the interior are amongst the many who are training their staff on how to treat a patient infected should they enter the facility.
We want to be ahead of the curve. Do we think it's going to hit us? We don't think it's going to hit us. We don't know, but we have to be ready, and we have to protect our staff.
CDC has outlined symptoms of the virus Ebola, which they say is not airborne, but only transmitted through bodily fluids of a person actively experiencing the symptoms.
Fevers over 101, coughing, excessive sweating. Any individual like that would be immediately placed in a protective room where those that are treating that individual would be geared with the latest in protective equipment.
Some Fairbanks residents have begun to take precautions against the virus and advise others to do so as well.
I call it awareness theater, trying to get people to think about it, maybe ask questions of their health providers and their politicians. Are we really staying ahead of the game to protect the population if a sick person with Ebola gets off on the airplane?
Now, although no cases have been reported in Alaska, providers are still taking necessary precautions.
Right now, we've put in place screening in our emergency department, and I think that's happening nationally as well, where anyone presenting to the emergency department is immediately asked if they have been traveling, and if so, where they've been traveling. We want to make sure that we are catching folks that have been to affected areas. Right now, that's resting in West Africa, even though we know that some cases are migrating out of West Africa.
From Fairbanks Memorial Hospital, I'm Stephanie Woodard reporting.